Today we are here with a mom who's going to give us her experiences. This is Dr. Psy.D. Silva. She is a registered clinical psychologist and she also works at the Family Center. Hi, Sandy.
Hi.
Now, you have two children, correct? And what are their ages?
Yes, I have a 6-year-old whose name is Eva and 21-month-old named Mila.
And tell us a little bit about your children, their personalities, their temperament.
So as was told to me before I had my second child, no two children are alike, and that is very true. So just exploring who they are, who they're growing up to be, has been a wonderful experience, and I think definitely is what makes parenthood the most satisfying experience, because as soon as our children are born, they are themselves. They are their own little people, and we immediately realize from day one that we don't have complete control over them, and they're going to grow up to be who they are destined to be, which is really exciting.
So as a clinical psychologist, does that make parenting any easier?
So my clinical psychology hat does not stay on very firmly as a parent, which is great though, because I don't want my children to be parented by a clinical psychologist and to be analyzed all the time. But it definitely does help me in that I feel like I am at an advantage. I have the benefit of having a tool bag of more tools to be able to use, and I just have to remind myself to use those tools. That's also why I'm so passionate about the work. I love working with children, with families, with parents, because I want to share with them as many tools as I know through my educational experiences and of course my own parenting experiences. And so when a tantrum is happening in my home, I will go to all my tools. I don't just use one, I don't just believe in one of them, but I may use any of them. So I may, withhold my own attention, like, okay, I'm not even seeing that right now. I'm going to step over you. I'm going to walk around you because I need to still get breakfast on the table. Or I may have that time to be able to pick her up and give her the hugs and the kisses that I know that an ounce of my attention is going to probably prevent another 10 to 15 minutes of this. Or I may do a time away. So if a tantrum is coupled with sort of a smack of her sister, I may do the sort of very firm, no, smacking is not allowed at home, smack is not allowed, point blank. And she may have a 1-minute time away in her room. And so I may sort of go to any of those different tools. And so, having that educational background definitely helps my toolkit.
So putting on your clinical hat, why do children between this 24-month, or even as you say yours is 21 months, and let's say 3 and 4 go through this stage?
So using my clinical hat, it would be that they're sort of trying to achieve this sense of independence. And that comes along with trying to communicate. This is when talking and walking and dressing and feeding, all of that is really happening at an independent stage. And we're trying to push for it as parents. And so it's a very natural part of their development. They're supposed to go through this. And that's really important so that they can understand where limits are, how to communicate things. And so what's amazing is that they can take in and they can understand so much of what we say to them, and they can't give the same responses. And so just like when we think of an electrical circuit that gets overloaded and then blows its fuse, it's the same thing with the child. They're going to eventually become quite frustrated and anger, and they're going to blow their fuse. But that's okay. That's normal. That's when they then understand, what, though, there's someone here to care for me. I'm still safe. Even though I may lose my temper right now, I'm still safe. And that's really essential for children to get at a very young age. It's critical for their healthy development over time, is that they understand that they are safe, they understand that they're cared for, and that they understand that they can be successful. So after a tantrum, if we can help them to try to communicate in some way, shape, or form what they were really needing or wanting, and we can help them to achieve that, then their sense of success from that is also critical to their development.
Taking off your clinical hat, when you are in public, have you had any experiences with your children, quote unquote, giving a temper tantrum? And how do you deal with it? How do you avoid the feeling of embarrassment, when you think that all eyes are on you?
That's a great question, is sort of how to manage these challenging behaviors in public when you are a parent. And when we've all carried our own our own perceptions of how parents should deal with it before you become a parent. So I remember being that pre-parent and sort of, having my own maybe judgments on what's going on when I watch this happen to other people. So I think for me, two of the biggest examples that come to mind are the grocery store and getting them back in the stroller when you are in Hamilton running errands or things like that. What I have found has been key has been prevention. What am I doing to contribute to the situation? And am I taking them to Hamilton on a bunch of errands, or am I taking to the grocery store when I know that they're going to eventually be hungry or tired? So not to do those things around nap time, not to do it when they're hungry. One of my big tricks is always carry my purse full of snacks and water, because we know that when children are over hungry, when they're overtired, then those are huge triggers to challenging behavior. So I definitely feel the embarrassment that all the other parents do. What I have to tell myself is, there are other parents around me that have been through this, that go through this, and so get rid of the embarrassment, because most of us have been in the same boat or going through it. And so I sort of use my tricks of carrying the snacks and water in my purse, making sure that I don't take them to places when I know that it's going to be a challenging time. So nap time for me is a really sacred time at this age, not to do too much around that time. I also try to engage them a lot in what I'm doing, so making it fun. So, okay, we're going to go into Hamilton, we have to run these couple of errands. But you know what, Eva, I want you to be able to find these things and do a bit of a scavenger hunt. So really engaging them and doing a lot of prevention as to what I know would trigger them are my best tools for handling behavior in public.
What are some of the tools that you use in order to stay kind and patient with your children, to recharge your batteries, so to speak, so that when those challenging times come, you can be able to give them love and show them firm discipline at the same time?
Another great question, Katrina, and it's definitely one that I talk about with families that I see in my office all the time, and I talk about with my husband all the time. How do we recharge so that we're not contributing to the problem? And sometimes you have to recharge in that moment, absolutely. So I use humor and breathing a lot. For example, this morning I used, okay, we're going to sing everything that we're going to say for the rest of the morning to get us through the morning. That really made them laugh. So using singing, dancing, turning on the music, breathing myself. I've even gone as far as saying to my 6-year-old, Eva, press my reset button. Please press it right now, or in my belly button, so that they can also see that here's what mommy does to recharge, and they could watch me doing that. Another great thing that I do, and I learned this from another parent, was when I get in the car and we're off to drop-offs, there's 2 questions that I ask my children. One is, what are we thankful for today? And it's a really great way to reset the morning, especially if it's been a challenging one. What are we thankful for, and what's our visualization for the day? What do we want out of the day? And it's wonderful when I hear like my 6-year-old say, Mommy, I want you to not have too much paperwork today. But it's really about sort of sharing my experiences with them. Again, using breathing and humor has been my best ways to recharge.
Putting on your clinical hat again, share some last tips and thoughts with us of what parents can do, or behavior that parents can model to ensure that their children model that good behavior.
Yeah, that is really important, because our children are watching us all of the time, and the first 5 years of life are where we are really setting the foundation for their development, and we're planting all the seeds of what we want to expect from them as they get older. And so when we model for them our frustration, and when it plays out in a way in which we're losing control, then it's going to teach them that, yeah, losing control is the answer. So if we're also hitting and smacking them, then they're going to learn that I hit and I smack when I get angry too, because that's what mommy does, or that's what daddy does, or that's what Nana does, whoever the main caregiver is in the home. So it is really important that we keep that check on our own behavior. And that goes back to being able to use whatever tools you find most effective. Giving yourself a timeout is fine. Being able to go into a room and close the door and take some deep breaths is really important. That actually shows good modeling. It actually shows children how to give themselves their own time away. Using humor is a really great one, because when you want to divert a child's attention and use distraction, that's what you're doing when you're using humor. So that's sort of teaching them the power of distraction, which is really important. So modeling our own behaviors is really is critical. And you're also really reinforcing to your older child how to deal with the behaviors. Because how many times do we find our older children wanting to discipline the little ones just the way we're doing it? Or when they, like I the other day I heard my oldest daughter, she was combing my youngest daughter's hair, and she's like, just keep still, don't move your head. If you move it, it'll hurt more. I thought, oh gosh, that's me. So it just shows the critical importance of, you know, how we're talking. And it's important to use humor around that too. Like, oh wow, Eva, that's what I say to you. So maybe mommy will change the way that I talk to you when I'm combing your hair. But, you know, using humor and being able to really watch out that we want to model good problem solving and good calming, cooling down strategies for our children. Another final tip that I have found that it has been so important in my own parenting is making sure that I do prevention. And so when my child is when they're responding in a way that is abnormal for them, that I look to see, well, what could be going on? You know, are they over hungry at this time? So when I get home, if I've been thinking that my child can withstand me cooking dinner for 45 minutes, that may not work. I may now need to change it that when I get home, you know, the little one's dinner is already made, it's done. So I can avoid a tantrum at 5:30, 5:45. Another piece is being overtired. You know, how do you ensure that your children get the right amount of sleep? Are they sick? That's a huge one. And so when they're sick, of course they're going to be more irritable, so are we. And that's one where you really want to make sure that, you know, you're checking their temperature, checking how they're feeling, if they're responding abnormally as well to things. So really checking in with, are they sick? Are they overtired? Are they over hungry? Are they bored? Are they cold? Are they hot? Checking with all of those things, because remember, this is the age where they can't communicate that very easily. So you need to be responsible for checking in with whether that's happening for them. And that all speaks to prevention.
So how does being a parent affect your counseling?
So just like when I come home, my clinical psychology hat doesn't completely come off, but it's also not completely there. When I had my children after I became a clinical psychologist and was already working in the field, and I found that becoming a parent definitely impacted how I was with parents that I worked with. I found that it just gave me a deeper sense of empathy for what they're going through, and I could no longer sort of avoid my own personal experiences coming in the room. Certainly it is my job to keep my personal life out of the therapy. However, it gives me a deeper sense of empathy and also a deeper sense of understanding. So when a parent explains challenging behavior that they feel like, but I have no control, I don't know what else to do, or I just keep losing it, I don't just go to the structure of what my educational background would tell me to suggest. I feel like I can actually give a richer experience for the parent to be able to say, I get it, I totally get it. And is this what it's feeling like for you? I think I can connect with the parent as the person a lot better now that I am a parent, because I can relate with those experiences.
Wow, Sandy, I just want to really thank you for, bringing your experiences, sharing with us. And I really hope that, parents are able to pick up some of the secrets and the tools that you have shared with us. I know I've gotten a lot of extra tools that I can use within my own family. So thank you, Sandy.
Thank you for doing this. Bermuda Parent Magazine has been a wonderful tool because we know that parents need different mediums. You need to be able to hear snippets of what to do as a parent on the radio, but also, in the written word and on TV and wherever it is, wherever you can sort of get those seeds planted in. So you guys are doing a fantastic job. So thank you for having me.
Thank you. With Tammy Dowling from Onion Patch Academy, and she's going to share some thoughts with us on how to avoid the power struggles that sometimes we have with our toddlers. So Tammy, the first question that I have for you is, what are some of the techniques used in daycare settings when dealing with power struggles?
The most common techniques that are used is verbal communication and choices. It's really important that staff are clear and concise with what they're saying and what they want from the child or what they don't want from the child. So being kind but firm when speaking to the child is very, very important, and that's what's pretty much mostly used in today's daycare settings.
So Tammy, does having a daily routine assist with parents with power struggles?
Oh, absolutely. Having a daily routine sets the child up for success. They know what to expect, they know what's happening, so if you want to ensure that at lunchtime it's a quiet, it's a smooth routine, you know, the children will know, oh, I have to clean up my toys, oh, I have to wash my hands, so they know what's coming next. So having a routine definitely helps. Having physical and mental activities at home stimulates obviously the brain. It improves concentration, self-esteem, and it also lowers anxiety and stress. So when the child is feeling good, only good benefits come from it. So it's definitely a win-win situation.
Great. What are some ways that parents can recharge their own batteries when they're dealing with a daily power struggle?
Well, what I recommend for parents basically is to remain calm, talk in a clear, calm voice. As soon as you get angry, the child has won the power struggle. So the most effective benefit would be to remain calm and talk with a clear voice. Be positive, not negative, because the child will feed off of that. That's my recommendation.
What are some of your recommendations on even the process from getting from the home to the car to that event or to that particular place that parents can deal with or assist to not have that power struggle?
Absolutely. And unfortunately, it does start at home. It has to start there before you go anywhere. So to set the child up for success, both you and the child up for success, I recommend having a sit-down 2-minute conversation about what's going to happen, where you are going, and what kind of behavior are you expecting before you leave. And when you get to, say, like the grocery store, before you even exit the vehicle, have another little chat before you leave and say, okay, we're going to go in shopping, we're going to get bread, milk, and eggs. We're not picking up any treats or balloons or any knickknacks today. Today is just about baking. And remind them that I expect you to use walking feet, whatever your expectations are that you want your child to behave in the store. So as you're going through and you're going to the checkout, there's chocolate bars, there's candies, and the child wants ones. And you can just kindly remind them, say, remember, in our talk at home and in our talk in the car, we weren't going to buy treats today, just bread, milk, and eggs. Thank you so much for listening. Always praise the child for their good behavior. Not reward, but praise with your words. And again, if it doesn't happen and it does turn into a nightmare, the most important thing is to leave the grocery store, go back in the car. You can reiterate your words again and try it one more time. If it doesn't work, I would recommend leaving. Again, this may take a few trips, and the child needs to establish those patterns of behaviors, but eventually over time, they will get it and they will know, when I go to the store, I need to behave this way. As long as the parents are very clear and concise and firm in what they're saying, the child will listen.
Thank you, Tammy. That was excellent advice and tips.